What are ICD-10 codes, and why do they matter for lymphoma medical records? Imagine trying to keep track of thousands of different diseases and conditions across the world. That's where ICD-10 codes come in. These are standardized alphanumeric codes used globally to classify and document health conditions, including cancers like lymphoma. ICD stands for International Classification of Diseases, and the number 10 refers to the 10th revision of this system, which is maintained by the World Health Organization. These codes help doctors, hospitals, researchers, and insurance companies communicate clearly about specific health issues. For lymphoma, especially non-Hodgkin lymphoma, ICD-10 codes are crucial. They allow healthcare providers to precisely record the type and stage of lymphoma a patient has. For example, non-Hodgkin lymphoma can have codes like C85.14 unspecified B-cell lymphoma or C83.394 primary central nervous system lymphoma. Hodgkin lymphoma has its own set of codes, starting with C81. These codes help ensure everyone is talking about the same disease in the same way. Using ICD-10 codes in medical records offers many benefits. First, they ensure accurate documentation of the diagnosis. Knowing the exact type and whether the disease is active, in remission, or relapsed helps doctors plan the best treatment. Second, these codes create a common language among healthcare providers, making it easier to share information across different clinics and hospitals. Third, researchers relying on ICD-10 codes to identify patient groups, track how often lymphoma occurs, and evaluate how well treatments work over time. Insurance companies also depend on these codes for billing purposes. Proper coding ensures that hospitals and clinics get reimbursed correctly for the services they provide. Lastly, ICD-10 codes help keep medical records organized and searchable. This organization is vital for ongoing patient care and advocacy efforts, making sure that every detail about a patient's lymphoma history is clear and accessible. In summary, ICD-10 codes are essential tools in managing lymphoma medical records. They support accurate diagnosis, effective communication, research, billing, and record keeping. If you or someone you know is dealing with lymphoma, always remember to consult healthcare professionals for personalized advice. Proper coding helps ensure that every patient receives the right care and that their health information is correctly documented for the best possible outcomes.